Our next guest is a world-recognized sports and regenerative medicine specialist. He has spent the last 29 years practicing and speaking on the topic of stem cell regenerative therapy. Dr. Dennis Lox is here, and he brought chapter engagement coordinator for the NFL Alumni chapter of Tampa Bay, Brandi Winans, with him. Brandi also happens to be a patient. Okay, so we've got a lot to talk to you about, but Dr. Lox, let's first talk about stem cell therapy. We hear a lot about it. It's not all created equally, though, is it?
No. There's a lot of confusion and misrepresentation right now about it. It used to be there wasn't so much heard about it. Now there's so many more people doing it, but not everybody's saying and doing the same thing. So it's just confusing.
Sure. And in treating athletes particularly, which is what we're concentrating on here, what do you have to do differently when it comes to treating sports people?
Well, the big thing is if we're trying to get them back in the game. And so the clock is ticking and we have deadlines, and so we're trying to manage that. If they're retired, it's trying to keep them as active as they can be, and everybody has different goals, and so that's what we concentrate on, is what the person's goals are.
Sure.
And it varies quite a bit.
And Brandi, let's talk to you as Brandi, the patient, first,
Yes.
before we talk to you as working with the NFL Alumni. What did you need to see Dr. Lox for? What was hurting on you, and were you close to getting a surgery?
I was seriously thinking of surgery, and because of my affiliation with the NFL Alumni and my husband being a former player, I knew Ian Beckles and Derek Brooks, and Derek referred me over to Dr. Lox one afternoon. I said, I need somebody, and I'm talking about that stem cell therapy, and he said, you got to see Lox, you got to see Lox.
So what was hurting on you?
Hip and shoulders. So I do kickboxing. I've been an athlete most all of my life, a horsewoman, et cetera, and I had a labral tear in my hip joint, my left hip joint, and I was in pain for almost 2 years. And every night, I can't sleep. I'm back and forth. And I made a phone call. He called me back. We sat on the phone for probably 30 minutes and made an appointment. I went in, and the following week I had 3 injections. I had the bursa, the 2 hip joints, and we said, while we're there, let's hit the shoulder too. So
one-stop shopping.
One-stop shop. And I was extremely skeptical from the aspect of my husband being a professional football player, passed away now, or he would be seeing Dr. Lox. But I was so skeptical, and within literally 48 to 30, I would say 36 to 48 hours, I was being able to sleep at night.
Isn't that something? And that's the greatest gift you can give somebody who's been in pain. Doctor, let's talk about, you use the patient's own personal stem cells, because there are differences in the types of stem cells, right? We got about 30 seconds, so if you can address that quickly. Sorry to do that to you.
No, it's quite all right. The rules in the United States, where you're compliant with the FDA regulations, same person, same day. And so we know where the stem cells reside in great numbers, so it's a matter of understanding what you're doing and getting them.
And to have that kind of relief in just a few days is amazing. Well, it's a lot of good work you're doing there.
Thank you.
Okay, for athletes or anyone, right? For more information, you can visit drlox.com. And Dr. Lox, Brandi, thank you so much for sharing your story.
Thank you.
Thank you.
All right, we'll be right back with more Daytime right after this.